organization in this area with over 4,000 affiliates across the country and around the world. My book, The Time Divide, published in 2004 by Harvard University Press, examined workplace policies that enable today's companies and today's families to work together effectively instead of being at odds with each other. I believe that the sick leave legislation before you is a modest but very valuable step in the right direction. First of all, sick leave policies are supported by the overwhelming majority of Americans. One national poll showed that 90% of voters favored paid sick leave as a basic employment standard. That's true for Democrats as well as Republicans. This is true because so many of us take sick leave for granted. Most professionals and managers have access to paid sick leave as a basic component of their benefits package. Indeed, most workers in most countries around the world are eligible to take sick leave. As you've heard, nationally, 40% of employees lack paid sick leave. In many of Philadelphia's service economy jobs lack sick leave. For example, only 26% of food prep workers, waiters and waitresses are eligible for paid sick days. And some of them do not have true access because they have not been working in a restaurant for long enough. As you know, sick workers spread germs and get others sick. This is particularly a problem in restaurants and retail sales where contact with the public spreads disease rapidly. During the recent flu epidemic, the H1N1 epidemic, those who went to work sick infected an estimated 7 million coworkers nationally. Evaluation, heard from a previous speaker in favor of business that business can't afford this. Unfortunately, that's the standard argument that they use with respect to any policies. You will recall that he had very few specifics related to the policies at hand here. Specific studies of similar legislation in other cities, such as San Francisco, show that the concerns of the critics are unfounded. First of all, the average worker used only 3 paid sick days during the previous year after a similar law was enacted. It turns out that employees tend to treat sick leave as insurance. They consider it a valuable benefit that they save it up as needed in case they're really sick, and they use it only as necessary. Surely there will be cases of people who will abuse it, but the most common abuse turns out to be taking your kid, staying home because your kid is sick. Studies have shown that Black, Latino, and low-wage workers benefit most from the law. It turns out that after the laws are passed, after sick leave legislation was passed in San Francisco, most employers supported the law, and very few reported adverse effects. So in summary, I think this legislation would be good for the people of Philadelphia and for the economy as well. Thank you.